I'm Dr. Yang. Welcome to ACES Well, where we help you decode your body's message and take simple daily steps towards better well-being. Today we're taking one of the most confusing health questions out there. Should you take probiotics when you are on antibiotics? Or more importantly, how do you do it the right way so your gut doesn't fall apart after medications? If you have ever had bloating, diarrhea, or lost your appetite after antibiotics, stay with me. We are diving into science, case studies, and real life strategies to heal your gut faster. Let's break it down simply. Antibiotics are powerful drugs that kill or stop growth of harmful bacteria, but they're not selective. They can also destroy the good bacteria in your gut and help you digest food, absorb nutrients, and regulate immunity. Probiotics, on the other hand, are live microorganisms. Often good bacteria kill lactobacillus or bifidobacterium that help rebuild your gut flora. So what happens if you take them together? Well, if you take probiotics at the same time as antibiotics, there's a good chance your antibiotics will wipe out the probiotics before they even get to work. So the answer is yes, take them in the same day, but not at the same time. Let's back this up with science. A 2020 review from the Journal of Clinical Gastroenterology found that people who took probiotics during and after antibiotic therapy had 42% lower risk of antibiotic-associated diarrhea. A study published in Gut Microbes recommends take probiotics at least 2 hours apart from antibiotics. Continue probiotics for at least 7 to 14 days after finishing your antibiotics. But not all probiotics are equal. Look for strains like Lactobacillus rhamnosus, Saccharomyces boulardii, Bifidobacterium lactis. These are the strains shown in clinical studies to support recovery and immunity. Let's look at the real case. Sarah, 34, graphic designer. She had strep throat and was prescribed amoxicillin. After 3 days, he had bloating and loose stools. He started taking probiotics with her antibiotics, but still felt terrible. After seeing a pharmacist, he spaced probiotics 2 hours away, added fiber to her diet. Within 3 days, her symptoms improved. On the other hand, Mike, 68, retired teacher, after pneumonia treatment with strong antibiotics, his digestion slowed down drastically. The doctor recommended probiotics along with prebiotics, basically food for probiotics like inulin, chicory fiber, and resistant starch. Mike also took warm peppermint tea and light walks every day. Within a week, his bowel movements were back on track and his energy returned. So, beyond the pills, there are 3 more things you can do to help your gut bounce back. First, add prebiotic foods. This helps probiotics thrive in your gut. Try oats, bananas, slightly green, garlic and onions, artichokes, and flax seeds. Second, practice deep belly breathing. Your gut and nerve system are deeply connected. When you are anxious, your gut gets tight and uncoordinated. Do this. Place your hands on your belly. Inhale for 4 seconds. Expand the belly. Hold it for 7 seconds. And exhale with your mouth for 8 seconds and pull belly in. Repeat for 2 or 3 minutes, morning and at night. Number 3, gentle abdominal massage stimulates digestion of calm proteins. Use circular clockwise motions around your navel with light pressure. This can be especially helpful before bed or after meals. There are acupuncture points around the belly, which you can also pressure and to make it work better. Here are some easy gut-friendly meals for recovery. Soothing chicken and rice soup. Bone broth, shredded chicken, white rice, ginger, carrots. Light and easy on digestion. Then overnight oats with kefir and chai. High in fiber and probiotics and banana slice and cinnamon for flavor. Warm chamomile or peppermint tea. Calm the GI tract, reduce cramping and gas. Avoid heavy fried foods, cold dairy, alcohol or caffeine, all of which irritates your recovering gut lining. Let's recap everything you need to remember. Yes, take probiotics during and after antibiotics. No, don't take them at the same time, spaced by 2+ hours. Choose well-researched strains, Lactobacillus GG, S. burgdorferi. Continue for 1-2 weeks after antibiotics. Support with prebiotics, breathing, and gentle massage and movements. Health is not about doing everything perfectly. It's about listening to your body, taking small, smart actions, and giving yourself time to heal. If this video helped you, hit the like button, subscribe, and don't forget to share this with someone who is recovering from antibiotics. I'm Dr. J.D. Yang, here to help you restore balance from the inside out. See you in the next video. Stay strong, stay healthy.